Hello, welcome to CBL everyone. I'm Anmol Mehta and I'm back with the Society Current Affairs for this week, 28th June to 6th of July 2020. So for this week, there have been very good articles and news facts. We are going to cover those, but much more important is one of the editorials we are going to talk about. So the editorials, these two editorials, the pandemic and the challenge of behavior change, and India needs social change to limit the future pandemics. So ये दो articles, this editorial appeared in Hindu, this appeared in Guardian. So these were very relevant. I expect at least one question around the pandemic this year. You might also be expecting that. And for society part, this is going to be majorly the question. I believe this explanation will help you write at least one answer. So please listen very carefully. I'll try to simplify these editorials for you. Right? So I have tried my best to simplify them, try inculcating those points, and last time I gave you questions. Only one or two attempted it in the comment section. Please others also attempt. I'll try to justify a way out. So this is talking about what kind of social change is required for the pandemic, that is COVID-19. So what is social change required? H1N1, the bygone pandemic. It happened when? Please comment. It was a pandemic during 2009 and 10. And even in 2018, it has caused 15,000 deaths. 15,266 deaths. But you may not have seen that in news. Why? Because the news walas want something new. उन्हें तो कुछ ना कुछ नया चाहिए. But H1N1 जैसा पैंडेमिक 15,000 डेथ कॉज करता है, जबकि उसकी वैक्सीन भी है एंड उसके लिए एंटीवायरल ड्रग भी है. Now we have a very useful antiviral drug. Science is there, but still deaths are there. So can you see, even with the drug, even with the cure, there are deaths. And so why the deaths? Because the only problem is lack of social awareness. Lack of social awareness is the only problem. That a pandemic like H1N1, कौन सा था जी H1N1? What was this about? H1N1 कौन सा flu था? Please comment, I am sitting with you. If you answer, I will say right or wrong. If you don't answer, I can't probably have an insight into your mind. So, H1N1 में drug भी है, फिर भी deaths हो रही हैं, तो this is lack of social awareness. So now talking about the bigger pandemic, the fear these days. The fear these days is COVID-19. So why it is bigger? Because it spreads much quicker. Which is the number which tells us about the ability of the virus to spread? Please again comment. Right, so it spreads much quicker and has no vaccine till now. Till now, COVID obviously does not have any vaccine commercially available. Right, so, but is COVID facing a new India? In 2009 and 10, when H1N1 became a pandemic, and now in 2019-20, when COVID is becoming a pandemic or has become a pandemic, so is the response different? Yes, it is. That is why it's saying, is it facing a new India? So yes, the response has been much better as compared to 2009 and 10. See, our response was quicker. There was a lockdown and the turning off of lights, etc. All the steps were taken. Why? Because they wanted social involvement, social awareness, and social contribution. Can you see the similarity between contributing as much as you can, the principle of Mahatma Gandhi, and the principle over here, turning off lights? They're trying to make you aware. They're trying to make your own contribution. Right? Today, your own contribution would be stay focused, because this is very important. So, but the response was good and social regulation and change was aimed at. So, although the lockdown was effective initially it was effective. But in the long run, it is impractical. Lockdown cannot stay forever. You cannot lock down people forever and ever, because then, as it is popularly said, it will not only be about living, it will be about livelihood. So how do we ensure, what is the solution now to ensure that people follow, or as it is said, people learn to live with it? People behave in the desirable way, wearing face masks, using hand sanitizers, or probably observing social and physical distances. So how do we ensure it? So what now? One idea is, one of the solutions is the HBM, or Health Belief Model. This has been developed by this person, Irvin Rosenstock, is one solution. What is that? बहुत मुश्किल बात नहीं है. I'll try to simplify it. कोई doubts हो, I'm sitting with you, please write it down in the comment section. So it is what? It is a model of social marketing. Social marketing क्या है यार? We are not looking for profit with this. We are trying to bring a social reform by using marketing techniques. So social marketing की technique है ये. It ensures that COVID recommended behaviors become socially desirable as well. That you do not have to force anybody to go for that behavior. Everybody goes for it automatically. Can that happen? How does this model say so? Right. So this model basically has these three key points: perceived benefits, perceived barriers, and cues to action. These three benefits. So what are these? Let me simplify. Perceived benefits, it says that एक आदमी एक तरह behave तब करता है जब उसे उसमें कोई फायदा दिखता है. And those two direct benefits. For example, it was seen in Bangladesh. बांग्लादेश ने पॉपुलेशन कंट्रोल के लिए मेजर चलाया. वहाँ पे देखा गया कि जब तक मेन को डायरेक्ट बेनिफिट नहीं दिया गया कॉन्ट्रासेप्टिव यूज करने का या फिर स्टेराइल होने का, तो तब तक दे कुड नॉट बिहेव इन दैट वे. Earlier it was said it would be good for the society, population would be controlled, it would be good for Bangladesh, but people did not behave like that. But when it was said that it would be good for you, yes, it would be good for you, then people started behaving that way. It was in the campaign, it was added that if population is controlled and if the men go for such and such contraceptive, it would be beneficial for their own reproductive organs, for their own reproductive health, for their own reproductive hygiene. So when they got their own benefit, then they started behaving in that way. So COVID also, this HBM model will say that wearing a mask should be portrayed as not only beneficial to the society indirectly, but directly to the individual wearing it. Right? So going further, perceived barriers. अब किसी एक्शन के बेनिफिट है तो उसके बैरियर्स भी तो है, मैं क्यों नहीं कर रहा. Japan has a social etiquette of wearing masks. Without even the pandemic, earlier they were wearing so. But why not in India? We used to, what do we call them? Who earlier, before this pandemic, used to wear masks. We looked at them suspiciously, that why is he wearing a mask? So now we want that behavior to be normal. Now we want people to practice social distancing. But sometimes social distancing becomes or has barriers. People cannot perform it. What is the barrier? For example, you are standing in a queue. लाइन लगी हुई है जी. अब क्यू में बैरियर क्या है कि भाई मेरे साथ आके कोई साथ में खड़ा हो गया. अब लाइन लगी, काफ़ी सारे लोग हैं, मेरा मन भी है कहने को कि यार सोशल डिस्टेंसिंग तो करो, बट इतने सारे लोग खड़े हैं लाइन में, अब मेरे से बोला नहीं जा रहा कि यार ये मारे ना मुझे. तो हाउ अबाउट दैट आइडिया? हाउ अबाउट टेकिंग अ क्यू टू एक्शन कि आप सारे लोग लाइन में खड़े हो, 10 लोग हैं, उनमें से 3 लोग चाहते भी हैं कि सोशल डिस्टेंसिंग करो यार, चिपको नहीं, बट वो कह नहीं पा रहे. सो हाउ अबाउट दिस क्यू कि वहाँ पे जहाँ पे भी रश ज़्यादा लगता है वहाँ पे डिस्प्ले बोर्ड हो जिस पे मैसेजेस अपने आप डिस्प्ले हो रहे हैं और एक स्टोरी फॉर्म में बताया जा रहा हो कि सोशल डिस्टेंसिंग अगर आप नहीं कर रहे तो आप क्या कर रहे हो, आप गलती कर रहे हो. यू आर एक्चुअली गोइंग फॉर अ क्रिमिनल बिहेवियर, यू माइट बी अरेस्टेड. सो जो मुझे कहने की लोड ही ना पड़ी, अपने आप डिस्प्ले हो गया, दैट वुड बी अ क्यू टू एक्शन। एंड उसके साथ आई कैन ऑल्सो पॉइंट आउट एंड से यार प्लीज कर लो, नहीं तो मैं भी रेस्ट हो जाऊंगा। So this is a cue. This is social marketing technique. This would ensure what? Socially desirable behavior. This is what HBM has. ये तीनों पॉइंट ध्यान से रखना, perceived benefits, perceived barriers and cues to action. Example, direct benefits as I said, society को नहीं, बंदे को। Telling to someone to stand, barriers कि मैं कैसे बोलूँगा जी, मैसेज बोर्ड लगा दो, जहाँ जहाँ ज़्यादा रश लगता है वहाँ मैसेज बोर्ड लगा दो। And one more solution could be that the personal hygiene को स्वच्छ भारत मिशन जो इतना फेमस हुआ है, इतना अच्छा चला है, उसका एक कोर कंपोनेंट बना दो। नॉट ओनली सोशल हाइजीन बट ऑल्सो पर्सनल हाइजीन कैन बी मेड अ कोर कंपोनेंट, right? So what can be the solution for social change? The HBN model, the core component of Swachh Bharat as personal hygiene, right? So these 2-3 things you can compile an answer with. First, why do we require the social change? Because even H1N1 deaths are happening, and this pandemic is much bigger. So it brings to you a challenge. So how would you bring social change? HBM model and these kind of suggestions. In these editorials, these two were there. Then further, what is the conclusion to it? COVID is a challenge along with a great opportunity. This is where you show that you are a true bureaucrat. You are a good aspirant who is going to be a very good bureaucrat. You just don't just see the dark of the COVID. You see light at the end of the tunnel. And again I repeat, you believe that the tunnel is illusion, light is reality. That is what we say when we say optimistic conclusion karo. It is not only a challenge, it is a great opportunity to do what? Reform the set scientific foundations to our behavior, to reform our society. For what? If properly ingrained, then this behavior change will serve us for times to come and for future pandemics. So let us utilize this opportunity to the fullest. So got the idea? These were so beautiful editorials about the pandemic and the social change required. And trust me, one question, either you're appearing in 2020, 2021, 2022, one question is expected out of pandemic, and that too I expect would be around social change also. So please be aware, and now let's be very serious and focused about it. So let's have a pattern how to utilize this. I have simplified one editorial for you. I'll keep on doing this throughout the weeks to come, right? As along with this series of CBL, we'll be providing you current affairs and editorial simplified. So what you are supposed to do? Pandemic एक टॉपिक है. अब आपके पास टॉपिक हो गया, ये पहला आर्टिकल आ गया, इसके बाद 50 और आर्टिकल मिलेंगे, राइट? उसका बेसिक तो सेम रहेगा कि चैलेंज क्या था, डेथ्स पहले वाले से हो रही हैं और आगे. उसके बाद यहाँ सॉल्यूशंस अभी 2 हैं हमारे पास. अगले आर्टिकल में आपको 2 और मिल जाएंगे, उससे अगले आर्टिकल में लेट्स से 1 और मिल गया. सो कीप ऑन एडिंग टू द सॉल्यूशंस. दिस इज व्हाट आई कॉल अ पोजीशन पेपर. व्हाट इज अ पोजीशन पेपर? That you take an editorial, note down the basic facts or introduction, then keep on adding to the solutions, so that when you have to write an answer in the exam, you have the introduction ready and you have a number of solutions. This is what will make you stand out from the crowd. Even if the UPSC is asking to criticize, then even you have to constructively criticize with solutions. So this is what will fetch you marks. Keep noting it down. PDF notes मिल जाएंगे, but खुद का position paper बनाया हुआ would become a unmol treasure, priceless treasure, right? So going further ji, now for topics of the news to be covered today. These are the topics. The Sanskrit Sadbhav Mandap, this was held for the minority communities. What was it? We'll talk about it. Then state of world population 2020, this report. Then millets in ICDS and PDS. What are millets and where they have been added? Under reporting of diseases due to pandemic, this will talk about the topic here, pandemic की रिपोर्ट, कोविड की रिपोर्ट करते करते हम बाकी सारी डिजीजेस को इग्नोर कर बैठे हैं, एंड दिस माइट बी वेरी वेरी डेंजरस फॉर द कंट्री. फॉर एग्जाम्पल टीबी केसेस अच्छे से रिकॉर्ड नहीं हो पा रहे, एड्स केसेस अच्छे से रिकॉर्ड नहीं हो पा रहे, बिकॉज सारा फोकस कोविड पे है. तो उससे क्या होगा, बिकॉज सारा फोकस सिर्फ कोविड पे है तो बाकी सारे इग्नोर हो जाएंगे, एंड दे माइट बिकम अ ग्रेवर कंसर्न अलॉन्ग विद कोविड, ऑल्दो इट रिक्वायर्स मोर फोकस, बट वी शुड ट्राई टू बैलेंस इट आउट एंड ट्राई टू इंक्रीज आवर वर्क फोर्स. Right, so next topic would be Sahiya Didis. What are Sahiya Didis? We'll talk about that. If you know it, please comment. Then adultery. There has been a small news piece on adultery. I hope we are aware what it is. We are going to talk about these 6 topics today in great details, in whatever is required, and covering all those sources. But one caution is, at the end of the lecture, I am going to ask you 5 questions. If you pay attention, you will be able to answer all those 5. Right? If you do not pay attention, you will not be able to answer even one. So please pay attention, कुछ ना कुछ अच्छा होने वाला है. Right? So moving on to our topics. First one is Sanskrit Sadbhav Mandap. So this is our Minority Affairs Minister who has laid down the foundation of this Sanskrit Sadbhav Mandap, which is a multi-purpose community center at Rampur in Uttar Pradesh, not in Himachal, right? So community center करेगा क्या? Various socio-economic, cultural activities and skill development during times of disaster such as COVID-19. क्यों कंस्ट्रक्ट किया जा रहा है जी? दिस इज कंस्ट्रक्टेड अंडर द प्रधानमंत्री जन विकास कार्यक्रम. सो मल्टी सेंटर कोचिंग, मल्टी सेंटर एक्टिविटीज होंगी. व्हाट आर द की पॉइंट्स? इट इज रीस्ट्रक्चर्ड. प्रधानमंत्री जन विकास कार्यक्रम इज रीस्ट्रक्चर्ड एंड रीनेम्ड फॉर्म ऑफ व्हाट? किसको रिप्लेस करा है? कई बार ये सवाल आ जाता है. रिप्लेस कर रहा है जी, रीनेम्ड फॉर्म है मल्टी सेक्टोरल डेवलपमेंट प्रोग्राम की. एंड द स्कीम वाज रीस्ट्रक्चर्ड ऑन द रिकमेंडेशन ऑफ स्टैंडिंग कमिटी on social justice and empowerment, headed by whom? Headed by Ramesh Bayas, who submitted their report when? Implementation of multi-sectoral development program Pradhan Mantri Jan Vikas Karyakram on 9th August 2018. So 2018 में ये रिपोर्ट आई, उससे ये संस्कृत सद्भव सेटअप हुआ. एंड इम्प्लीमेंटेशन पीरियड क्या है जी? टिल 31st March. Right, going further, funding, it will be centrally sponsored scheme. What is centrally sponsored scheme? If you know, tell me the funding pattern below in the comment section, please. I'll be sitting definitely with you. Right, in the year 2008-09, the government conceived the multi-sectoral development program, जिसको replace करके अब हमारा संस्कृत वाला आया है. Right, as a centrally sponsored scheme. So initially the MSDP scheme was launched in the 90 minority concentration districts as a pilot project. पहले pilot project की तरह लॉन्च करा गया, but targeted restructure कर दिया इसे 2013-14 में, and unit of planning for implementation बना दिया, and change to minority concentration blocks and minority concentration towns. And at present कितनी minority communities है इंडिया में? Muslims, Sikhs, Christians, Buddhists, Zoroastrians, those are Parsis जो Iranian descent के basically हैं, and Jains have been actually notified as minority communities in our country. So what are the other schemes? यार ये schemes आजकल ना UPSC भी बहुत पूछ रहा है. So हमें पता होना चाहिए सीखो और कमाओ minority से related है. ये बड़ी न्यूज़ में थी उस्ताद स्कीम. So this might be asked as it is. उस्ताद स्कीम इज रिलेटेड टू व्हाट? स्किल डेवलपमेंट. एक गलत ऑप्शन जरूर होगा इसमें. सो मिनॉरिटी कम्युनिटी है, ऑल्दो मिनॉरिटी कम्युनिटी वुड बी बेटर आंसर, राइट? सो गरीब नवाज कौशल विकास योजना. प्लीज राइट डाउन दी मिनिस्ट्रीज अंडर विच. वेरी वेरी सिंपल थिंग, बट मिनिस्ट्री साथ में लिख लेना अपने लिए. नई मंजिल, नई रोशनी एंड बेगम हजरत महल गर्ल्स स्कॉलरशिप. These are some schemes of the minorities. Then the constitutional provisions regarding minorities. You might have covered this. Simple backward linkage create कर रहे हैं हम लोग. As I said, topic कैसे करना है? The present news, the backward linkage, the forward linkage. That is the wholesome coverage. So constitutional provisions, Article 30. All minorities shall have the right to establish what? Educational institutions. And the protection under Article 30 is confined to only to minorities, religious और linguistic. ये चीज़ ध्यान देना यार. इंडियन कॉन्स्टिट्यूशन में religious और linguistic minorities protected है, कौन सी नहीं है? आप लोग बताओ प्लीज. Stop it and tell me. So it is ethnic minorities are not protected under the Article 30. Then and does not extend to any section of citizens. It is only for the minorities. Further, Article 350B. This is for what? Special Officer for Linguistic Minorities. ये कब ऐड करा गया है? 7th Constitutional Amendment Act से 1956 obviously. And it provides for what? Special Officer for Linguistic Minorities. Appointed by whom? President of India. So we should remember it as a fact कि 7th Amendment किससे related है? Special Officer for Linguistic Minorities. Right? It would be the duty. करेगा क्या ये Special Officer? To investigate all matters relating to the safeguards provided for linguistic minorities. Obviously, linguistic minorities का officer है तो उन्हें safeguard करेगा. And there is National Commission for Minorities Act 1992. The act defines minorities as a community notified as such by the central government. So you may be asked, आजकल trend है ऐसा सा, where is the term minorities defined? It is defined under Minorities Act, but that too is just a suggestive definition, not an exhaustive definition. So अगर question आ जाए, it is defined in detail under the Constitution? No. It is defined in detail under this Act? No. But it has been defined under this Act? Yes. Right? So going further, under this Act, the government formed the National Commission for Minorities. National Commission for Minorities Act के अंडर बनी है, तो स्टैट्यूटरी बॉडी होगी, ध्यान रखना. विच कंसिस्ट ऑफ अ चेयरपर्सन, अ वाइस चेयरपर्सन एंड 5 मेंबर्स. कई बार ये 15 मेंबर देके गलत करा देते हैं. एंड 5 मेंबर्स इंक्लूडिंग चेयरपर्सन शैल बी फ्रॉम अमंग्स द मिनॉरिटी कम्युनिटीज ओनली. ऑब्वियसली यू कैन से दैट. अब अगला, मिनॉरिटी राइट्स डे कब मनाया जाता है जी? व्हेन डू वी सेलिब्रेट द मिनॉरिटी राइट्स डे? इफ यू नो इट, स्टॉप हियर एंड कमेंट. राइट? सो नेक्स्ट स्लाइड यू विल हैव द आंसर. It is celebrated on 18th of December. Why? Because it marks the adoption of the right of persons belonging to national, ethnic or religious and linguistic minorities. The provision was, adoption or declaration was done on this day. So UN declaration on this rights of persons of minorities was adopted on 18th of December. That is why we celebrate 18th of December as Days of Minority. And what does it state? This declaration states that states shall protect the existence of national, ethnic, cultural, religious and linguistic identity of minorities within their respective territories and encourage conditions. Conditions for what? Conditions for protection of minorities. Right? So going for the next topic, the State of World Population 2020. This has been released by United Nations Population Fund. So United Nations Population Fund, आजकल direct question आया था, who releases State of World Population Report? UNFPA. Right? So what is this talking about? As we see in the picture, against my will. So this is majorly talking about women and girls. And what are the things which are undermining their equality? What are the things which are leading to their exploitation? It says that it highlights at least 19 human right violations against women and focuses on three most prevalent ones. देखो, वुमेन पे सवाल तो आना ही आना है. ऐसे आ जाए, सोशल इश्यूज में आ जाए, कहीं पे भी आ जाए, आना ही आना है. So what are the three most prevalent things for women, let's say human right violation? So first is genital mutilation. Second is extreme bias against daughters in favor of sons. Third is child marriage. अब आंसर लिख रहे हो आप लोग. women के against. So you can quote this. UNFPA is a recognized, well-known body. Informed opinion के तौर पे ज़्यादा marks लेने के लिए you can use these 3 points. Although you will get a PDF, but note these. What are the 3 most prevalent human right violations against women? Female genital mutilation, extreme bias against daughters in favor of sons, and child marriages. These are the biggest problems. So what are the key points regarding this? The number of missing women. What are missing women? Missing women, these are women missing from the population at a given date due to what? Due to cumulative effect of postnatal and prenatal sex selection in the past. The phrase was coined by our very own Amartya Sen. So diagnostic techniques के diagnosis के misuse से prenatal या postnatal sex selection and gender rejection कर देते हैं कुछ लोग. Very unfortunately, that is why those women who were meant to be born are missing. This is missing women. कितनी ज़्यादा missing है? It has doubled over the past 50 years. Right? So going further, in Afghanistan, Bangladesh, Pakistan, excess female mortality of girls below 5 years of age was under 3%. Now what is this excess female mortality of girls? This means it is the difference between observed and expected mortality of the girl child or avoidable death of girls during childhood. जान के यहाँ तो मार दिया जाता है या जान के मरने दिया जाता है. That is called excess female mortality. जितना expected था और जितना हुआ उसमें कितना ज़्यादा फ़र्क है mortality में, females की death में. Right? That is excess female mortality. And according to estimates, averaged over a 5-year period, 2013 to 17, ये 1970 की बात नहीं हो रही कि आप सोचो अब तो वुमेन को एक्सप्लॉइट करते ही नहीं. 2013 से 17 में there were 1.2 million missing females births. 1.2 million females were missing at the global level. And हमारे इंडिया की बात करें, हमारे इंडिया में आप लोग सोचेंगे यार ये तो अच्छा होना चाहिए, but very unfortunately 1 in 3 girls missing globally due to sex selection, both pre and postnatal, is from India. So India is one of the worst performers over here. Very sadly, 46 million out of the total 142 females missing is from India. 46 million is a huge number, right? And India has the highest rate of excess female deaths. अभी हमने पढ़ा excess female deaths क्या होता है? At 13.5 per 1000 females, or 1 in 9 deaths below the age of 5 due to postnatal sex selection. So इंडिया का डाटा एक बार नोट डाउन कर लो तो बड़ा काम आएगा पेपर में, कहीं भी, एसए में भी, सोसाइटी के आंसर में भी, क्या पता प्रीलिम्स में भी. So please keep noting it down. So going further, in India around 4,60,000 girls went missing at birth, which means they were not born due to sex selection each year between 2013 and 17. 4,60,000 girls were not born because of sex selection, even though we have a law against sex selective diagnostic techniques. Which is that law? Please again comment. Right? So going further, India along with China, 40% India में, 50% हमारे आजकल के बहुत अच्छे दोस्त चाइना में, account for around 90% of the estimated 1.2 million girls lost annually to female feticide. फीमेल फीटस को ही मार दिया जाता है 40% हिंदुस्तान में. दैट इज वेरी 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 अनफॉर्चुनेट. एंड फीमेल जेनिटल म्यूटिलेशन, वी नो यार, फीमेल्स के पार्ट्स को म्यूटिलेट कर दिया जाता है, वेरी सैडली फॉर नॉन मेडिकल रीजंस. एंड बेसिकली ये फीमेल्स को बेनिफिट भी नहीं कोई कर रहा. Does that mutilation benefit the female? No, it does not. Circumcision may benefit the male, जिसे हम सुन्नत बोलते हैं, that may benefit the male, but this mutilation does not medically or biologically help the female in any way. But still, it causes hurt, swear bleeding. It is done, and when it is done, it causes swear bleeding. It may cause problems in urinating, cysts, and ये जो बहुत बड़ी प्रॉब्लम है आजकल, यूरिनल इन्फेक्शंस जो हो जाती हैं, those are very common amongst females, and still they are actually subjected to this genitalia or genital mutilation. So that's again very unfortunate. Going further, an estimated 4.1 million females would be subjected to mutilation in 2020. These are huge numbers again. So going further, there has been an extreme preference for sons over daughters in some countries, which has fueled gender biased sex selection or extreme neglect, which leads to girls' death as children, resulting in missing females. अब females missing हो जाएंगी तो क्या हो जाएगा? सेक्स रेशियो इम्बैलेंस हो जाएगा, डेफिनेटली होगा, बिकॉज फीमेल्स कम हो जाएंगे तो सेक्स रेशियो आपका कम होता रहेगा. व्हाट इज द एग्जैक्ट डेफिनेशन ऑफ सेक्स रेशियो? अगेन, प्लीज टेल मी, प्लीज बी मोर, लेट्स से रेस्पॉन्सिव. इफ दिस इज अ मोनोलॉग, मैं बोली जा रहा हूँ और आप सुन रहे हो, ध्यान दे रहे हो, नहीं दे रहे हो, हाउ डू आई नो? लेट इट बी अ डायलॉग. मैं कुछ बोल रहा हूँ, आप सुन रहे हो, मेरे को पता लग रहा है आप कमेंट सेक्शन में लिख रहे हो, एंड आई एम सिटिंग विद यू ओवर हियर ऑनलाइन. So please keep on commenting the answers. Please give it your best. We are trying our best over here at CBL. So sex ratio imbalances हो रहे हैं and gender bias sex selection करके हो रहे हैं और excess female mortality करके हो रहे हैं. And the advent of technology has increased access to ultrasound imaging, which allows parents to terminate a fetus. But this has been ruled illegal, but still it is prevalent. And due to this, number of girls missing, those exceed those that are missing because of postnatal selection. These skewed numbers change the population and proportion and result in marriage squeeze. What is marriage squeeze? Sex selection करके females का number कम हो गया है, तो अब एक phenomenon हो रहा है marriage squeeze. Marriage squeezes, it happens when prospective grooms far outnumber prospective brides. महल्ले में लड़के ही लड़के हैं, शादी करना चाहते हैं, बट लड़कियां सिर्फ 2 हैं, 20 लड़के और 2 लड़कियां. अरे भैया, होना क्या चाहिए? होना तो ये चाहिए कि लड़कियों की वैल्यू बहुत ज़्यादा बढ़ जानी चाहिए. बट अनफॉर्चुनेटली होता क्या मैरिज क्वीज में? फर्दर रिजल्ट्स इन ह्यूमन ट्रैफिकिंग फॉर मैरिज एज वेल एज चाइल्ड मैरिजेस. एंड ह्यूमन ट्रैफिकिंग अगैन अनफॉर्चुनेटली फीमेल्स की होती है. सो उन 20 लड़कों में से जिनके माँ बाप बहुत अमीर हैं, वो बचपन में 2 लड़कियों का ब्याह करा देते हैं और पकड़ के अमीरों के घर में ढक देते हैं. द गर्ल अगेन गेट्स नो चॉइस, राइट? सो दिस ऑल्सो इज अनफॉर्चुनेट. प्लीज रिमेंबर मैरिज स्क्वीज. दीज वायलेशन रिजल्ट्स इन फ्यूअर चॉइसेस फॉर फीमेल्स. जबरदस्ती ढक देते हैं, जो मैं बात कर रहा था. एंड सेक्शुअल, इकोनॉमिक एंड लीगल कंट्रोल ऑफ मेन. This is what is happening when there's child marriage is happening. The economic dependence of female is leading cause of abuse and human right violations. We should know this. And child marriage कितनी हो रही है यार आजकल? नहीं हो रही. हमें लग रहा है क्योंकि हम इंडिया में रह रहे हैं शायद. भारत में जाके देखो, 33,000 girls under age of 18 are forced into marriage, usually to marry much older men. वेरी सैड. छोटी छोटी उम्र की लड़कियों को बूढ़े बूढ़े लोगों के साथ शादी करी जा रही है. जस्ट व्हाट माइट बी द कॉजेज अकॉर्डिंग टू यू? मेजरली इकोनॉमिक, राइट? एंड इन इंडिया, चाइल्ड मैरिज इज डायरेक्टली लिंक्ड टू पॉवर्टी, पुअर एजुकेशन एंड ज्योग्राफिक लोकेशन एंड रूरल अर्बन डिवाइड. सो दैट इज व्हाट आई एम ट्राइंग टू से. इंडिया में नहीं, भारत में जाके देखो क्या हाल है. इतनी सारी लड़कियों के साथ चाइल्ड मैरिज की जा रही है. दैट इज वेरी वेरी unfortunate, right? And there is COVID induced challenge as well. The economic disruption and income loss caused by COVID. What will it do? Whenever there is a pandemic, the vulnerable classes are made to suffer the most. What has it? It has intensified the unwantedness of daughters and gender discrimination. Why that would have been done? Because people now feel कि यार पहले हमारे पास पैसे कम है और ज़्यादा जैसे हम गलत धारणा से मानते हैं कि daughters are burden where they are the greatest assets for a family. But due to COVID, the unwantedness of daughters has seen to be increased, and abuse against women has increased. Gender based discrimination has increased. So this is another challenge. The COVID pandemic threatens to reverse all the progress we have made over the time for women empowerment. So this is another challenge for women empowerment. In India, COVID has reduced access to what? कॉन्ट्रासेप्शन, एबॉर्शन सर्विसेज, जा ही नहीं पा रहे तो कॉन्ट्रासेप्टिव तो वैसे ही हम शर्माते थे लेते हुए, जो नहीं करना चाहिए। अब तो सेक्स एजुकेशन स्कूल एजुकेशन का पार्ट है, बट हम कॉन्ट्रासेप्शन और एबॉर्शन सर्विसेज पे नहीं जा पा रहे। सो इंक्रीज इन अनवांटेड प्रेगनेंसीज एंड अनसेफ अबॉर्शंस है, दैट अगेन मे लीड टू some problems for the woman. But what are the initiatives appreciated in the population report? There has been that the report pointed out that successful education related interventions and provision of cash transfers on school attendance have been helpful. They have exactly pointed out this Apni Beti, Apna Dhan, the initiative as being helpful in India. Right, this initiative has been helpful in India. And now about the background, the backward linkage, as I always say, UNFPA क्या है जी? UN General Assembly का subsidiary organ है and Asexual and Reproductive Health Agency है. Earlier it was established as a trust fund in 1967 and began operations in 1969. So UNFPA है, देखो जरा ध्यान से, in 1987 it was officially named United Nations Population Fund. तो UNFP होना चाहिए, बट A क्यों है? Because abbreviation UNFPA was maintained, जो इसका पहला नाम था यूनाइटेड नेशंस पॉपुलेशन फंड फॉर पॉपुलेशन एक्टिविटीज। सो एक्टिविटीज जो वर्ड है ये UNFPA एब्रीविएशन रिटेन्ड है, बट अब ये सिर्फ फंड फॉर पॉपुलेशन है। एंड एस्टैब्लिश मैंडेट कौन करता है जी? इकोसॉक, इकोनॉमिक एंड सोशल ऑर्गेनाइजेशन। And UNFPA is not supported by UN budget, but entirely voluntary contributions है इसमें, UN budget support नहीं करता है इसे, right? And it works directly to tackle sustainable development goals. ये याद कर लेना एक बार यार, 3 वाला हेल्थ है, 4 वाला एजुकेशन है, 5 वाला जेंडर इक्वालिटी है, सारे भूल जाओ, 5 वाला याद रखना प्लीज, राइट? सो व्हाट इज द वे फॉरवर्ड? आंसर लिखना है तो वे फॉरवर्ड के बिना तो आना नहीं। सो द प्रॉब्लम शुड बी टैकल्ड बाय एलिमिनेटिंग द रूट कॉजेज ऑफ जेंडर बायस नॉर्म्स। पीपल मस्ट फॉस्टर रिस्पेक्ट फॉर वुमेन। कैसे होगा ये? चेंजिंग द एटीट्यूड्स, अगेन द प्रैक्टिस ऑफ साइकोलॉजी। इसीलिए एथिक्स बहुत जरूरी है, बिकॉज हर चीज करने के लिए हमें एटीट्यूड चेंज करना है। वो कैसे करना है? एथिक्स हमें सिखाएगा, साइकोलॉजी हमें सिखाएगी, राइट? पीपल मस्ट प्रोटेक्ट वुमेन एंड गर्ल्स बाय इन्फोर्सिंग लॉज अगेंस्ट प्रैक्टिसेस लाइक चाइल्ड मैरिजेस, फीमेल म्यूटिलेशन, एंड ऑल्सो बाय चेंजिंग एटीट्यूड्स अगेन। सो एटीट्यूडनल चेंज, बिहेवियरल चेंज के लिए बहुत ज़्यादा जरूरी है। अब गवर्नमेंट्स क्या कर रही हैं? पीपल ने कर दिया अपना काम। गवर्नमेंट नीड टू actually eliminate practices which violate the human rights of women. They have entered into treaties, they have ratified international treaties. Now they should perform accordingly. They should ensure strict enforcement of laws, right? So this is how we'll try to go for these topics: the present, the backward, the forward, right? So try going slowly with these. You can pause and read if you are not able to read quickly. You can note down 2 or 3 points, and please keep on answering what I'm asking. That will motivate me to work even harder for you, right? So going further, the next thing, introduction of locally produced millets in ICDS PDS. कहाँ पे हुआ है जी? ये उड़ीसा में। अब मिलेट्स का फायदा, ICDS क्या होता है? पहली बात तो व्हाट इज ICDS? इंटीग्रेटेड चाइल्ड डेवलपमेंट सर्विस। PDS तो हमें पता है, पब्लिक डिस्ट्रीब्यूशन सिस्टम। सो मिलेट्स को इंट्रोड्यूस करके गरीबों में बांट के PDS से क्या फायदा है? पब्लिक डिस्ट्रीब्यूशन, पब्लिक को मिलेट्स दे के क्या फायदा है? बिकॉज इट विल हेल्प विद न्यूट्रिशनल सपोर्ट, न्यूट्रिशन में हेल्प करेगी। हंगर ही नहीं, हिडन हंगर को भी क्योर करेगी। व्हाट इज हिडन हंगर? Again, help me in the comment section. Again, I say, I repeat, I'll be sitting with you. Please answer and I'll be answering back. Right? So going further, जी उड़ीसा ने मिलेट्स को इंट्रोड्यूस करा है। उड़ीसा मिलेट्स मिशन 2017 में। And the state's millets mission aims to what? Popularize the local production of millets among the farmers and increase local household consumption for better dietary diversity. अच्छा टर्म है ना, dietary diversity. And nutritional gains. टर्म नोट डाउन कर लेना, पेपर में काम आ जाएगा, राइट? इट इज एन अटेम्प्ट टू डेवलप डिसेंट्रलाइज्ड इंफ्रास्ट्रक्चर फॉर प्रोसेसिंग एंड रीपॉपुलराइजिंग मिलेट्स। right? So key points, it aims at what? Intends to integrate locally grown millets as a part of public food systems as ICDS and PDS. It also aims to build climate resilience. Millets are much more climate resilient as compared to rice or wheat, right? And promote agroecological farming methods for cultivation that draw on chemical-free agriculture and locally sustained food systems. So ना ही सिर्फ ये गरीबों का भला करेंगे PDS में देके, ये सबका भला करेंगे by actually including millets. They will solve the nutritional deficiency, they will solve hidden hunger, they will make the agriculture more climate resilient, they will ensure the farmers' income. So what an idea, Sarji, right? So ideally the aim is to make districts self-sufficient with produce, procurement and distribution. What is the need? Immense malnutrition. Immense malnutrition is the need. See, I told you that nutritional needs would be solved. And the immense malnutrition in Odisha requires it because the state has about 41% women who have a below normal body mass index. According to whom? National Family Health Survey. Right? So, बहुत ही malnourished facts and stats हैं इस state के. So that is why. And what are millets? It is a collective term. ये बहुत ही basic geography है, environment है. Small seeded annual grasses की collective term है. Example क्या होगा इनका? The example would be what? Tell me. Ragi, jowar, little millet, bajra, and variga. So we should know these examples. And what are millets? We always know this. I think you know this. So the districts will be using their district mineral foundation. This is where you might be confused. कि district mineral foundation का क्या काम है? This will provide funds to implement the initiative. District Mineral Foundation will provide funds to implement the initiative. DMF है क्या जी? It is a trust set up as a non-profit body. 1-2 साल पहले आया था UPSC में. What is DMF? So under the Ministry of what? Ministry of Mines. Through Mines and Minerals Development and Regulation Amendment Act. So again, statutory body. Please remember this. These are the kind of questions being asked. So the objective is to work for the interest and the benefit of persons and areas affected by mining related operations in those districts by affecting the mining works. The money will be credited in farmer's account. जो millets उगाएगा उसको पैसे मिल जाएंगे. And all the district will provide 1.5 kilograms ragi per person out of the 5 kg per person entitlement. ये सारे facts हैं. बट इसमें ज़रूरी क्या था? कौन सी मिनिस्ट्री है, कौन इम्प्लीमेंट कर रहा है, कितना मिल रहा है? 1.5 किलोग्राम रागी पर पर्सन, राइट? एंड these will complement the agricultural practices. The millet drive is largely focused on what? As we said, diet diversity or food diversity. And it will ensure availability of food to farmers. Farmers who have adopted bio inputs would be motivated. जो आप अच्छे इनपुट्स लेके आ रहे हो वो मोटिवेट करेंगे उस चीज़ को, ये वाली स्कीम. एंड विल बी गिवन इंसेंटिव्स फॉर 3 years. 3 साल उन्हें इंसेंटिव भी दिए जाएंगे. एंड फर्दर द स्टेट गवर्नमेंट विल ऑल्सो बी इंसेंटिवाइजिंग एग्रोनॉमिक प्रैक्टिसेस इंक्लूडिंग पेस्ट एंड वीड मैनेजमेंट थ्रू ऑर्गेनिक मेथड्स. But it will not actually exclude the chemical based fertilizers. Incentivize organic को किया जाएगा, exclude chemical वालों को भी नहीं किया जाएगा, right? So the way forward, the focus on non-chemical approaches coupled with a focus on nutrition and food security. Non-chemical approach भी है, nutrition भी है, food security भी है उसी स्कीम में. Distinguishes the Odisha approach from that of the union government. What is the difference? Such interventions are generally driven towards creating attractive markets and ignore the household. The fact that this endeavor approaches millets from point of view of nutrition and safe food is important. सिर्फ इंटरवेंशन अट्रैक्टिव मार्केट बनाने के लिए नहीं है, वो घर की न्यूट्रिशनल सपोर्ट को भी देख रही है और साथ के साथ हेल्प कर रही है फार्मर को भी, क्लाइमेट रेजिलिएंट एग्रीकल्चर को भी. right? So now going to the next topic. I hope you are following it, you are focused on it. As I said, आज लास्ट में 5 सवाल जरूर होंगे, ध्यान देना उन पे, राइट? सो अंडर रिपोर्टिंग ऑफ डिजीजेस ड्यू टू पैंडेमिक. एज आई सेड, आउटब्रेक्स जब होते हैं, इतना सीरियस आउटब्रेक हमारी जनरेशन ने, मेरे ख्याल कितनी सारी जनरेशन ने नहीं देखा होगा. सो कोविड आ गया, इतना बड़ा पैंडेमिक आ गया, तो अब उस वजह से क्या हो रहा है? उस वजह से ये हो रहा है कि सारा का सारा मेडिकल इंफ्रास्ट्रक्चर, मेजॉरिटी ऑफ इट इज कॉन्सेंट्रेटिंग अपॉन कोविड. उसकी रिपोर्टिंग, उसकी लेट्स से मैनेजमेंट, ऑल्दो आई डोंट से कि उसको ना करो मैनेज, बट बाकियों को इग्नोर हो रहा है. Diseases such as TB, you know, a recently very unfortunate incident happened. A 6 months old baby came to one of the hospitals, I'll not name it, one of the hospitals, and he had a cardiac trouble. कोई birth wise congenital cardiac trouble होता है, and he was admitted for that treatment, and very unfortunately he died of COVID because he caught it in the hospital, because it was too much focus on COVID and ignorance for that little baby. So what is happening in this news piece? So this is saying, according to information on weekly outbreaks available on the website of IDSP, that is Integrated Disease Surveillance Program, there has been unusually fewer instances of diseases. आपके करके भाई आप क्या सोच सकते हैं कि कोविड आने से बाकी सारी डिजीजेस हट गई, कि रिपोर्टिंग कम हो रही है? See, there are two sides. एक तो ये है कि हम लोग पर्सनल हाइजीन पे ध्यान दे रहे हैं, हम लोग बाहर कम निकल रहे हैं, बट also that there has been a limitation on infrastructure of this integrated disease surveillance program. जो weekly reports IDSP issue करता है, the disease outbreaks across the country have been much lesser. जो 600 districts में रिपोर्ट आती है, उनमें बीमारियां बहुत कम बताई गई हैं. द लेटेस्ट रिपोर्ट अवेलेबल वीक 12 की है, मार्च 16 to 22, रिकॉर्ड्स अ मेयर 6 डिजीज अलर्ट्स. एन अलर्ट क्या होता है जी? अलर्ट इज अ साइजेबल नंबर ऑफ केसेस फ्रॉम अ रीजन आर रिपोर्टेड. सो इस बारी सिर्फ 6 डिजीज अलर्ट्स हैं. द 6 अलर्ट्स किस बारे में? एक क्रीमियन कॉन्गो हेमोरेजिक फीवर, कैसे कॉज होता है अगेन प्लीज कमेंट. Then 3 cases of chicken pox and a case of dengue and food poisoning. सिर्फ 6 instances बताए गए. That is very less. In 1 week, 11 of 2020, 28 alerts and 12 of which were for COVID-19 only. तो बाकी कितने रह गए? 16. However, the 3rd of May, there is again an increase in reports of other diseases. But the data suggests that it has not been completely normalized as compared to previous years. So देखा जा रहा है डाटा से clearly कि अंडर रिपोर्टिंग ऑफ अदर डिजीजेस है. देन इंटीग्रेटेड डिजीज सर्वेलेंस प्रोग्राम है क्या चीज जी? इट इज IDSP is a portal, is a one-stop portal which has facilities for data entry, viewing reports, outbreak reporting, data analysis, training modules and resources related to disease surveillance. So ये IDSP का पोर्टल आप लोग भी यूज कर सकते हैं for tracking or getting authentic information about diseases around you so that you can be safe. Right? It was launched by Ministry of Health and Family Welfare with assistance of, this forms important, वर्ल्ड बैंक यार UPSC का बहुत अच्छा फेवरेट दोस्त है, बेस्ट फ्रेंड है, तो बार बार पूछते हैं किसके साथ किया गया? मिनिस्ट्री ऑफ हेल्थ ने लॉन्च किया विद असिस्टेंस फ्रॉम वर्ल्ड बैंक. राइट, वी शुड नो दिस. And what is the past scenario? In the same week in 2019, there were 17 alerts. In 2018, 28. In 2017, 45. And there are no records in 2020 after week 12. That is after March 22. Because reasons. What are the reasons? The reasons are lockdown and the behavioral change due to COVID-19. Next, presence of only testing and treatment for COVID-19. हर जगह COVID-19 का रूल है. It is kind of rolling our every system, right? Even it has changed all the education, so it has changed the medical profession. And IDSP faces a manpower crunch. मैन पावर क्रंच तो हर जगह है, चाहे आपकी इंडस्ट्री थी वहाँ लेबर नहीं है, आपका हॉस्पिटल है वहाँ पे स्टाफ नहीं है, right? So everywhere. So the way forward, the neglect of other diseases has been observed by reduction in the notification of fresh tuberculosis infections and a general decline in claims under आयुष्मान भारत हेल्थ इंश्योरेंस स्कीम. सो क्या देखा जा रहा है कि फ्रेश ट्यूबरकुलोसिस के केसेस भी बहुत कम हो रहे हैं और आयुष्मान भारत के क्लेम्स भी कम हो रहे हैं रिपोर्ट. So what is that pointing towards? Under-reporting. It is debatable how useful this would be to improve COVID-19 surveillance. But it is essential in improving overall surveillance as well as providing timely updates about present infections. Although the pandemic needs serious focus, but India cannot afford to ignore other diseases and infections, right? So this is what we were trying to say. कि एक कोविड के चक्कर में सारी डिजीजेस को इग्नोर नहीं करना चाहिए. दिस इज सी वेयर वुड यू यूज इट? यू कैन यूज इट इन इवन द कोविड रिलेटेड आंसर्स. मीन्स में आंसर लिख रहे हो तो एक स्ट्रीम ये भी है कि कोविड के आने से एक डायमेंशन ये भी है. सी जीएस में तो जितनी ज़्यादा डायमेंशंस लिखोगे उतने ज़्यादा नंबर आएंगे. सो कोविड रिलेटेड क्वेश्चन में एक डायमेंशन ये भी हम सोच सकते हैं. दिस वुड हाउ द क्लासेस वुड बेनिफिट दैट because of COVID, other diseases are ignored, right? Again, you will have to think of a optimistic conclusion. So now next topic, the last one, adultery. The Supreme Court has refused to review its 2018 judgment about adultery. What is adultery? क्या होता है जी adultery? If you know, it was upheld in September 2018 judgment about by the Constitution bench which had struck down adultery out of the penal statute book. So what is adultery? 497 section है सर. वकील भाइयों बताओ what is adultery? So adultery is nothing but when you have sexual intercourse outside your wedlock. It was actually a provision which was said to commodify women. Basic क्या provision था adultery के बारे में कि suppose A and B are married. Let's say A and B are married. A is the husband, B is the wife. So the adultery provision said that if the wife B has intercourse with another man without the permission of A, then that another man would be एक्चुअली प्रोसिक्यूटेड फॉर एडल्ट्री. मतलब हिंदी में बोले तो सिंपल भाषा कि इसकी बीवी उसका प्यार, राइट? सो क्या हो रहा है इसमें, क्या प्रॉब्लम क्या थी? बिकॉज दिस ए हस्बैंड एंड बी वुमन, बी द वाइफ कैन नॉट गो विदाउट परमिशन into any other relation, but if the man goes, he is not punished for adultery. Even the woman is not, but the woman's autonomy was compromised. प्रॉब्लम ही क्या थी वुमेन राइट एक्टिविस्ट को कि वुमेन को कमोडिफाई करा जा रहा है. एक तरह से सेक्सुअल ऑटोनॉमी नहीं है उसके पास और वो मैन के परमिशन से क्यों चल रही है. अगर ऐसा है तो बराबर करो, मैन के लिए भी अडल्ट्रस दिस से you should actually criminalize the adultery for man as well. It was gender specific in a way, although it was not punishing the woman, but it was held to be restricting the sexual autonomy of women. So when now the judgment was reviewed, the Supreme Court refused to review it. And basically बात किसकी बात कर रहा है? Indian Penal Code 497 की, cannot command married couples to remain loyal. सी अच्छी बात है यार ये कि आप अगर अपना ए और बी का कपल था, अगर आप आपस में लॉयल हो तो अपनी अंडरस्टैंडिंग, यार किसी के डर से लॉयल नहीं हो सकते. डर तो तब तक रहेगा ना जब तक नज़र है. जहाँ नज़र हटी वहाँ आपको पता है क्या हुआ, दुर्घटना घटी. सो फियर ऑफ लॉ से आप जोड़ के नहीं रख सकते. टू इंडिविजुअल्स मे पार्ट if one cheats, but to attach criminality to infidelity is going too far. This is what the Supreme Court says. Do you agree or not? It's up to you. The court had reasoned that there was no data whatsoever to support the claims that abolition of adultery as a crime would result in chaos in sexual morality or increase in divorces. So सुप्रीम कोर्ट कहता है कि यार हमारे हिसाब से ऐसा नहीं होना चाहिए. अगर एडल्ट्री को डीक्रिमिनलाइज कर दिया गया तो सारी जो अच्छी वुमेन थी और अच्छे आदमी थे उनमें भी डाइवोर्स हो जाएगा, या जिनकी अपना आपस में अंडरस्टैंडिंग थी, लेट्स नॉट से अच्छे एंड बुरे, जिनकी आपस में अंडरस्टैंडिंग थी वो लोग भी पार्ट अवे हो जाएंगे बिकॉज ऑफ एडल्ट्री क्रिमिनल नहीं है तो चलो जी. ऐसा नहीं होने वाला. दिस इज व्हाट सुप्रीम कोर्ट सेज एंड दिस इज वन मैच्योर्ड डिसीजन एज वेल, राइट. सो नाउ कमिंग टू माय सेक्शन ऑफ प्रीलिम बेस्ड क्वेश्चंस. अगर आपने आज मुझे ध्यान से सुना है तो आप इन क्वेश्चंस को आसानी से आंसर कर दोगे, राइट. सो द स्टैंडिंग कमिटी ऑन सोशल जस्टिस एंड एम्पावरमेंट विच सबमिटेड इट्स रिपोर्ट ऑन 9th August 2018 was headed by which of the four? Bimal Jalan, Vivek Devroy, Ramesh Beas, Ranga Rajan. Please answer in the comment section. I am looking at these. I'll give you the answer in the comment section. Right? A, B, C, D. Choose one among the following. Right? Then next, State of World Population Report. अभी डिस्कस करी थी, आपको पता होना चाहिए. Who among them? World Population Organization पब्लिश कर रही है, WEF World Economic Forum पब्लिश कर रहा है, या UNICEF पब्लिश कर रहा है, या none of the above. What is the answer? Please again comment section. I am sitting with you. Right. So third, which state recently introduced millets into ICDS and PDS? अभी करा यार, होना चाहिए याद. प्लीज मेरे को ऑप्शन ना पढ़ने देना, पहली आंसर लिख देना. उड़ीसा, पंजाब, झारखंड, none of the above. Right? I hope the questions are visible and clear. Please keep on answering. Then the integrated disease surveillance program was launched in assistance with. ये तो जस्ट अभी कर रहा है. अगेन मैं ऑप्शन ही नहीं बताता, ऐसे ही बता दो यार. ICDS program, sorry not ICDS, IDSP program, integrated disease surveillance program was launched in assistance with WEF, WHO, World Bank, IMF. I don't think I need the options for the answer. Next, the term Sahiya Didis recently seen in news refers to what? Helpers along the LSE, distribute free masks, members of social police to guard against COVID norms violations, or the ASHA workers. Please tell me in the comment section. Again, I thank you all for looking at the video, and the answers will tell me whether you were focused, whether my efforts have been successful. So please keep on answering, please keep on participating. Let's make it dialogue. Let's make the story of success. I thank you all from behalf of CBL team. Thank you so much. This is Anmol Mehta saying bye-bye. Thank you.